Hi. So I'm in healthcare, in hospice. So is this a product that it's from Intel, or and it's free?
No, it's not.
Okay. Can you tell me about it?
Yeah, so this is the Intel Health Guide. It's a two-part solution. So
Okay.
this is the in-home device. Sits in the patient's home. The clinical back end that sits in a home care agency or a physician's office, wherever the folks responsible for monitoring.
Physicians and RNs are.
The way it works is patient goes through daily assessment, sort of like a virtual visit.
Okay.
Go through, depending on their condition, we've got a number of care protocols that come standard with the solution. And so right out of the box, we've got symptomatic Q&A tailored to specific disease states like CHF or COPD or diabetes, etc. So we go through a full assessment. It's going to collect all of this data, all of this symptomatic Q&A data, as well as any sort of pertinent vital sign capture that's part of an assessment. And at the end of the assessment, all of that data is uploaded to the back end. And if the patient has something out of range, they've broken a threshold, whether a vital sign threshold or something symptomatically out of range, they get presented first here in our home screen. It's basically a triage screen.
Okay.
So the folks in red have something, they've indicated or reported something out of range for them. We've got a group of patients where, and this is fairly common among elderly folks who start a session kind of like we did. The phone rings and they get distracted and they'll finish the session. After about 20 minutes, the product will time out.
Okay.
Said whatever data it did capture. But that patient's record is going to be yellow, so it indicates an incomplete record
I see.
or a skipped day.
Okay.
That way the clinician kind of knows and can follow up on that in that regard. And then of course, patients that are fine and everything's within range, they will be presented in my green section down there. We not necessarily be worried about how they're doing today based on that information.
And does the device connect to wireless internet, or can it go through a phone line, or?
Supports primarily broadband, wired broadband.
Okay.
It doesn't support Wi-Fi.
Does not support Wi-Fi.
No Wi-Fi, but it does support 3G wireless with a USB dongle.
Okay.
We do have dial-up support, but we start to de-feature some of the capabilities.
它是医疗更远程的一个，比如说你用户把这个做回去，
把这个做回去，咱们可以自己拍，自己弄血压、量脉搏啊。
Can you give me an idea? Is it
放到
customizable?
这个电脑上，然后这个电脑上再传到医生的那个，
We can customize
上面有各种功能项。
the care protocols themselves.
Okay.
We've got a lot of content that comes standard, multimedia content, teachable moment content. That can all be customized. You can take that standard content, you can take licensed content from like Mayo Clinic or American Heart Association. And so if you're managing a population of CHF patients, for example, you could take VHA content and not use the standard content that comes with the solution.
Have you rolled this out with any healthcare agencies yet?
Yeah, so we have several deployments with small and mid-range or medium-sized home care agencies. We've got a few pilots underway with the big insurance firms as well. So we've got a big pilot underway with Mayo Clinic, et cetera, United Healthcare, Cigna. With the big health insurance companies, they're looking for solution-specific efficacy before they do a broad deployment, so that's what those pilots are doing.
Do you know about how much the program costs, the whole thing, approximately?
It's a range, right? So it really depends on, you asked a great question about customization. We have professional services that can help, and so depending on the amount of customization that's done, depending on obviously the volume on the device side, the pricing is going to be dynamic, as well as the peripherals that you bundle.
Sure.
But in general, sliding scale between $1,500 to $1,800 per device. And then we try to get, whether a customer buys it outright or reaches to have a leasing arrangement with somebody like a GE Healthcare, we try to get it such that it can be deployed in the range of $100 to $200 per patient per month.
Okay.
Again, that all is dynamic depending on the complexity.
That's very reasonable. That's very. Do you have any medication dispensing units that connects to this yet?
Not currently.
And so you get blood pressure. Do you get temperature?
Take your
For
temperature.
thermometer.
Currently, we don't have any Bluetooth or USB thermometers validated.
Okay.
But you can do that via manual entry. So
Oh, okay.
traditional
Okay.
thermometer.
So you can input the data
Yeah.
manually.
Go in and just type it in.
Okay. Great. Thank you so much.
Sure.
Appreciate